So sadly, I have another person report that passed away last night, and that makes 181 total. So to the family, my condolences and prayers go out to. It was a woman in her 80s, and to all the families from this weekend. We had 6 residents pass away since Friday, and my heart goes out to the families. These are difficult times that we're going through, but more difficult when you lose somebody in these tough times. And it's hard because on Saturday we lost, a female who was in her 56. We lost another male in his late 50s. And when you start to see that number go down, it's alarming. And, we have to be careful. I know people have fatigue. I know they're tired. But the reality, it's still there. The vaccine's around the corner. I know the state is hoping to get FDA to sign off on Moderna, I think it's called. And they get 350,000 vaccines by the end of this month, which would be awesome. And on top of that, the first shot was given out today at 9 a.m., which is also good news. So we're starting to step in that right direction. But I want to remind people that there's over 19 million people in New York State. And, if you look at it this way, only 6 million live upstate around the surrounding areas going up. The rest of it, like 13 million plus, is in the New York City metro area. So, it's going to take time for that vaccine to get out. You're talking roughly almost 20, New York State residents, and you have to do our most vulnerable first, our nursing homes and so forth, and hospitals. It's going to take 5 stages. So please be patient. I know we're going to continue to educate people on getting the vaccine and the importance of getting the vaccine, especially when we still see these alarming numbers. And our hospitalizations, it's one of the things we continue to watch. We had 2 people under the age of 25, one under the age of 17, and luckily one of them got out. And we continue to look at the hospitalizations now between 25 and 49. There's 12 currently in the hospital on Sunday. And as of today, the hospitalization for 20 to 25-year-old to 49 is 12. But excuse me, we still have 2 people under the age of 25. I thought that person got out, but in the age 50 to 74 is 40. So again, we're starting to see alarmingly that number that we identified early on that have spread quicker than any other age group. Now it's starting to affect them a little bit differently. So please be careful, do the right thing, stay vigilant. To the 6 family members and to the ones last night, again, my prayers and condolences go to you. To the 181 Albany County residents that passed away from this awful disease, my prayers and condolences, but please take a moment to think of them to get through this. As of today, there's 7,951 positive cases of COVID-19. 3,244 people are currently under mandatory quarantine, and today is 154 positive cases overnight. Yesterday was 173 new cases, the day before was 198, and it was one of the things, we're at the peak of Thanksgiving, but you still have Christmas, we have Hanukkah, Kwanzaa, all that going on, and people excited to go out and go shopping. And we got to be careful. We got to keep our guard up. And it's good that, here's an argument. We were having a little bit in the office, not our debate, I shouldn't say argument. You sit there and go, 154 cases. You start to get numb to the bigger numbers, and then we start to look at hospitalizations and everything else. It's difficult. Because again, it's here, it's out in the community. Our hospitalization goes up, it goes down. One of the things I'll get into is about the new cluster zones and microclusters that the governor announced the other day, but it's here, people. And I've watched more people lately, that little domino effect even around me, that people are starting to fall to this. And we're seeing more and more spread of it. Why? Is it because of the holiday? Is it because people are just tired of it? We hit the 9-month anniversary on Saturday, and I can assure you, as I sit here, I didn't think 9 months later I'd still be doing this. And we're all hoping that we'd get through this. But the light's at the end of the tunnel, and we can get through this by staying vigilant and making sure that we work together in a partnership. So the positive cases, 14 have close contact to a positive case, 1 is a healthcare worker, and 1 reported traveling, and 138 don't have a clear source of infection. Over the last 5 days, we've had 182 new positive cases each day. Yesterday, it was 188.4. As of today, 28,217 people have now completed quarantine. Of those, 6,312 tested positive for the virus and have recovered. 143 recoveries since yesterday, which is good. There are now 86 people currently hospitalized from the virus. Yesterday, we dropped down to 80. You know, it was one of the things when we were talking about, do we come in on the weekends, and I said if things go sideways. Saturday did kind of go sideways, but you know, I made the conscious decision to hold off a little bit on the weekends, and also I spent the night all night long because my mother went in the hospital, who's currently in the hospital now Friday night, so I was dealing with that till 4 in the morning. But it's one of the things that it's there. We got to be careful, we got to stay vigilant, and we have to continue to move forward. There are currently 11 new hospitalizations overnight. 13 patients are currently in the ICU, up from 12 yesterday. Again, I just sound like a broken record. Continue to tell people, wear your mask, cough into your arm, clean your hands, stay 6 feet apart, and we'll get through this. You know, but again, we'll get through this if we continue to work together. So one of the other things, the microcluster zone, I've gotten so many questions on it. You know, I know Friday the governor announced that he might update the microcluster zone today. But some of the things in it, they did change. Like if we were in orange zone, it would be triggered by hospital capacities at 85%. And then it would say if you had a percent positive rates above 4% for more than 10 days. So what changes? So in that, salons, barbershops, gyms will be able to stay open. However, gyms will be restricted to 25% capacity. And then the other businesses that might be affected are restaurants. They might be limited to indoor dining to 50 to 25. Depending on hospitalizations, don't stabilize. So you're seeing that in New York City. The restaurants closed down over the weekend. So, you know, it's one of them things that we have to be cautious of. And I will say this, I can't answer every question that comes in when people are saying, why aren't we in zones? Why aren't we this? Listen, we're trying to do the right thing. And again, this virus has reacted differently and it changes and you have to change with it. And the best way I can explain this to you is that that's what I assume the governor and his team are doing, and the Department of Health for the state is doing, is that they're readjusting fire as they see this thing affect different areas and how the zone works, doesn't work, and rearrange it to make sure it works for the people and the residents of New York State. So that's the best thing I can say to you. I don't know how better to explain it to you. As we get the guidance from the governor's office or through our control room, we put it out to you. But yes, it does continue to change. Like I've said earlier, I said 9 months ago, I think. It's, you know, look, they're his rules. We're on his field. We're playing it, and you know, we have to adjust, and we have to adjust as this COVID-19 continues to affect not just the Capital Region differently, but the whole state of New York. So, in this nation, if you're watching what's going on around the world, but you know, it's you know, one of the things that, you know, we continue to talk about COVID, and again, government still moves forward, things still happen. We have Christmas. We have more families that are in need of cheering up. We have more families that are out of work because of the COVID-19. And again, and we have landlords. And yes, we do. I want to recognize this because one of the biggest complaints I have been getting from is people that own real estate. It doesn't mean because they might own a 2-family, they might own a couple. We do realize the landlords do have a lot of heartache too, because if they're not being paid rent, they can't pay their bills either, you know. So we do realize that, and there's some things we're trying to address, and I'll get into that later in the briefing. But some of the positive things, or the great things, what I love about the Capital Region, people that live here, right? And what makes the Capital Region in a great place to live, to raise a family, are people that are the fabric of our community that do extraordinary things. And I've said this early on, one of the biggest regrets you don't want to have is 9 months from now, when this all settles down and the dust is away, is how you acted through this, you know? And that's why I say about young kids wearing masks or doing the right thing and all that other stuff. And I could go on, but it's what you do, what makes that character who you are. And Peter Scotto, who's president of Advanced Therapy, who provides pediatric therapy, like early intervention, speech, physical therapy. I could go on and on and on. Who has a great company, who did extraordinary things this summer by helping families with their kids and giving them free services this summer. So one of the things he knows, and I've known Peter for a long time, he saw what we were doing here every day and talking about children and trying to give them a little hope. And like I said, when you see that wish list from kids, and they're not looking for PS5, I know what that is now, my kids straightened me out, and you know, Nintendo and the rest, yeah, you're getting the rest of it. You know, when they're asking for blankets or plates and forks and knives to eat food off of, it breaks your heart. You know, it breaks your heart when you see kids lining up overnight through the night to get these games or do different, you know, get stuff that's just coming out. So I want to say to Peter in Advanced Therapy, thank you. So today we are announcing he is donating $10,000 to Albany County to help kids have a brighter day on Christmas. So they can wake up with something under the tree or just wake up with a little wish list that they have. So we do have a community foundation for the Greater Capital Region. It's a nonprofit we use to raise money for adoptive family programs and provide toys and basic necessities for families during the holiday. And Peter, I can't thank you enough for doing this. This is going to make a difference in a lot of people, because one thing I learned with the other toy drive we did with the Marine Corps was there's people that helped out last year that this year needed help. So Peter, please take over and explain to what you're doing, and thank you so much.
Let me first say I'm very sorry to hear about your mother, and I hope for a speedy recovery.
Thank you.
It's a tough thing to go through with a loved one, and it's very challenging for everyone out there. I want to say thank you very much for this opportunity. We were very pleased to have this chance to give back to the community, particularly the kids. They're a soft spot. They've given me so much in my life with the company and its success. And after all, these are the people that have no voice. They look for us for a voice, these children. They come into this world without a voice, and until they grow up and we send them off to college and expect to have their own voices, they really rely on us. And Christmas is something that I've always appreciated, and obviously from my accent, you could see I'm not from this area. I'm originally from downstate.
We won't hold that against you.
No, you don't have to, because I lived up here much longer than I lived down there, so I'm really more of an Albany person. But I do recall my fond memories of Christmas. It's always been an enjoying time. I also can relate to some of these kids where the toys were lacking, or you were limited to more of the necessities. Like in my days, it was the underoos, which I never particularly cared for. But I'm hoping that this contribution, even though it may seem significant, when you look at 400 families, it's really not much for each family member. And I hate coming on and asking people to donate more, because when you looked around, a lot of businesses and individuals have done a lot. I saw the gentleman from Boys and Girls Club collecting cans to raise money. So it's very difficult to ask people to do more if they've already done it. But if you happen to have a little bit to aside and you have the chance, this is a great program, whether here, in other counties that offer it, to give that kid that one toy to open up is beautiful. And I hope that we're able to do that. I really do. And I understand you also spend this money within the community, so you are giving back to the small businesses, which I think is a double plus for this program. I'm very happy to have this opportunity and even learn more about it, and I really do hope that it puts a smile on somebody's face.
Thank you, Peter. And it's going to put a smile on kids' face, because it's going to go a long way, trust me, in these difficult times for these kids out there. And there are a lot of people doing extraordinary things in the community, and I wish I can embrace every one of them. I wish I could make every one of them Citizen of the Month and really thank them for what they're doing, stepping up. Because again, like I said, don't have regrets 9 months from now, 10 months, 12 months from now of the way you behaved look back and reflect on the most difficult time in our lifetime dealing with this COVID-19 and struggling with the economy, that you did the right thing, that you were there. You were part of the solution, not part of the problem. And Peter Scotto and Advanced Therapy, thank you so much for everything that you're doing to continue to do for our community. If you want to donate, you can still can. You put a little challenge out there. You can go to our foundation, Adopt a Family, and it's on our website, and you can make a donation to make a difference in someone's lives. And I know it's hard. And if you need something, please, by all means, you know, it's not just for you to donate. There's families out there that are hearing this for the first time. Please, we want to make that difference in your life that day and help you out. So you can register to receive stuff. So thank you for all that. I also want to remind people, I'm getting a lot of questions. Our testing's up. That's why we did that app. Or I shouldn't say app, that's why we went on our Albany County webpage for testing, so you can see the availability times for kids. You know, and it's there. Please take advantage of it. Please get set up to take testing. We are checking into it. I know Walgreens said that, you know, they're not taking people for a while. There's a few other places. We're trying to get the answer. I don't know if it's because of lack of testing kits, what it is, but I know a few places are changing the way they're doing stuff. So we're going to find out, get to the bottom of that as we continue to try to get more testing out in the community. Our great partners with Whitney Young, our Times Union Mondays and Fridays, Waterville Dome on Wednesdays. But please, you know, we pay for it if you don't have insurance. If you go to Whitney Young, the number is 518-465-4771. UAlbany, as always, it's drive-through, it's quick, it's convenient if you have transportation, 188-364-3065. They don't charge. So the two places don't charge. Remember, the other places charge a co-payment. If you don't know your co-payment, call your HR department. They should know it, or you can call the number on your health card, and they'll tell you what your co-pay is. That's what you're going to have to pay. Also, Price Chopper, CVS, Priority One, Walgreens, and plenty of other places you can choose. Like I said, go to albanycounty.com, and you can see all the great places you can get tested, and especially if you have kids in the different age groups. So, you know, it's another question we get, and we put up there. So please, you don't need to have symptoms. Go get tested and make sure you're getting the help that you need. Also, I remind people, as always, about our mental health support. It's available 7 days a week, 8 a.m. to 5 p.m., 518-269-6634. It's not just for the adults, it's for children. I'm actually going to have Dr. G maybe join us this week to talk about what's going on there, because people they're struggling. You know, you see people getting in quicker arguments, tempers are going off quicker, and you know, I was, you know, talking to someone else about this, and you know, about how people walk by and they make sure, you know, they know who I am. They're like, I ain't wearing a mask. I know. What do you want me to do? I'm not going to argue with you. I can only just say, please put it on or stay 6 feet apart. I understand people's personal beliefs about the mask. I get it. I really do. But you can practice whatever you want to practice, but do it in your own home. Do it when you're walking around. You go into business, and I know it's hard because then people are like, I don't want to name the store, so-and-so store, you know, someone was in there at the counter buying something and they didn't have a mask on. It's hard for the workers too. Look, you know, it's the safety of the workers too. And trust me, they say something, but when the customer tells them the exact opposite, or they have to leave and they refuse to leave, it gets tough because people really feel that masks don't help. You can't change that. You can't change someone's inner working. It's not going to work, you know. Just walk away, and that's the best that I can say it. And you know, again, I get challenged too, and it's just like, I just can't believe 9 months later people are still, you know, trying to aggravate me by saying they're not wearing a mask. It's okay, I get it, you know. I just hope you do it around yourself and don't infect other people. So again, call them numbers. We have the great partnership with 211, with United Way. Thank you, Pecan, and everyone, everything that they do. They get involved with this stuff too, to make a difference in kids' lives. And New York State hotline number is always 188-364-3065. Just a continuation of what we've been talking about. I asked the chairman, Andrew Joyce, to join me today. You know, one of the questions we keep getting from small businesses and businesses in general is what we're going to do to help them, and the variety of the partnership with the Albany County Legislature for the $300,000 grants, not a loan, for small businesses that will be getting out. But they need help now. And one of the things too is that people have said, you're telling people to stay home, don't go out if not necessary, which is true. Well, then then you're saying go to local businesses or restaurants. Look, if you just seen what happened in New York City, our restaurants are not going to survive, just like our arts and music venues aren't going to survive if we don't do something. And we need action now, not later. And I do want to say one of the things, I know that Assembly member Pat Fahey and John McDonald were talking about this early on, but we were watching, what can we do? What can we do to help these restaurants, especially if they close down and they have to go to orders? And one of the biggest things we continue to see, and I see through the media outlet, is the price gouging that third parties use to have food delivered to their houses. And usually it can be upwards to 30%. So, as you watch that continue to go on, well, how does a business struggling now have to, it takes profit away from them. It puts more profit into third parties, and what do they really have invested in the community? They're not paying for property taxes. They're not paying for the facade of the buildings or workers' compensation, or for workers to help them put food on the table or pay their rent or pay their mortgage. So again, what can we do? And so one of the things I'm doing today, I'm going to sign an executive order. I talked to Chairman Joyce about this, and he's going to introduce a resolution in January, I believe, or next week.
We're going to do it very quickly.
Very quickly, to back my emergency order up, so when that power stops, that this will be effective for the capital region. So we talked about restaurants going to 25%, which I asked Chairman Joyce to sponsor the local legislation for dining to stop the third parties from charging. So what this is going to do, so today, with my emergency order, we will cap the fee charged for food delivery at 15%. So no one can charge over 15% for if they get food delivered by a third party. We're encouraging people to use, Grubhub, and to use all the different organizations out there to get food delivered to support local restaurants. And what better way can we do this by capping it at 15%? So this will take effect this Friday, and it will be renewed every 5 days until Chairman Joyce has it signed officially as law here in Albany County. But I want to say places have already done this. New York City, Seattle, and most recently Syracuse and Onondaga County have done the same thing. So it's something that we need in place. I was hoping the Senate and Assembly was going to do it. But if we truly want to support small businesses and restaurants, we need to do this. They're struggling, they're having a tough time, and we need to give them the relief that they need. And talking to not just Chairman Joyce, talking to Mayor Sheehan, talking to Paula Mahan and Colonnade, Peter Barber and Gilliland, this is something we need. If we want to see these restaurants survive and come into next year, this is what we have to do. And we're not saying this does not include the tip, so please tip the delivery people the same as you normally would. That 15% is not for the tips. We want you to. They're out there delivering your food and keeping it safe for you, so please continue to tip the delivery people separately. This is just a cap on that. And I do want to say, this emergency order will go in effect this Friday. We will hold these third parties accountable if they try to charge you over 15%. And I know I've seen some of the stories on some of the news outlets here that, people were paying $18 or, for a $12 sandwich to get it delivered. And, I've talked to people that are thrilled about this, not just the owners, but this young girl, Jasmine, who's a college student who was getting killed where she lives, having food delivered, and other people. So please, by all means, I'm going to sign this right now to make it effective of this Friday. If you're going to ask why Friday, because we got to give time to get the message out there to let the third parties know we're changing this coming Friday. And this is going to be the new standard in Albany County, 15%. So I do have the order to sign, which... Again, this is to help restaurants, small businesses, and be fair. So the executive order is signed. It will make it effective this Friday. And hopefully this makes it easier for restaurants to make a profit, stay in business, not make a profit, just pay their bills. and stop the gouging from these third parties. So I'm telling people, support your, Hub Grub and all them, still get the food delivered, but let's do it where it's a partnership, not a dictatorship when it comes to pricing and gouging. So please, this will take effect. It won't be over 15%. But Chairman Joyce, please.
Thank you, Mr. County Executive. It's been about a marathon, not only for our local small businesses, but for us here locally and everyone working to fight the pandemic. And it's been great to have a good partnership with you as these ideas come forward and we can implement them. The Albany County Legislature has really stepped up in a major way since the beginning of the pandemic, whether they were distributing PPE in their districts, volunteering for the county's Medical Reserve Corps, delivering food, and passing mission-critical legislation to keep county government functioning. They've done a lot, and the work continues. And a few weeks ago, Albany County Legislator Sam Fine brought this very issue to our awareness, and our staff has been working on it. The issue has gotten accelerated and amplified across the state. So we talked with the county executive's office, and we worked up this plan to do a bit of a 1-2 punch on this issue. So the county executive signed his executive order today, goes into effect on Friday. But what our legislation is going to do is going to provide these small businesses and these restaurants the means to seek enforcement and to get restitution if necessary. A bit of a 1-2 punch, and it really shores up their efforts in order to make sure that we're not price gouging. If you order 3 cheeseburgers from a restaurant, you end up only paying for 2. And the restaurant pays for the 3rd. And these restaurants and these small businesses are the fabric of our community. And it seems like every day, every week, we're hearing about one closing. So what we're going to do is codify what the county executive has done today. It's going to give restaurants the ability to seek relief and enforcement and to commence legal action if necessary if we see that these fees go above and beyond. A great partnership. I really appreciate your help and the effort that we've taken to move quickly on this, because we are in an emergency. We are in an emergency situation. We're in a pandemic. Typically, it takes about 3 months for us to pass a local law, but we're going to do this in a month because people are hurting out there. This is an emergency, and we want to make sure that we get this signed and ready to go and do it quickly. So thank you for your help and your efforts.
Thank you, Chairman, and I have to say thank you to all the legislators, because it is going to make a difference, and the quicker we get this done, the better. So again, to the small businesses, we're here, we're listening, and we're going to continue to do some extraordinary things here in Albany County to help you survive into the future.